Hi, my beauties. My name is Dr. Stefani Kappel, and I'm a board-certified fellowship-trained cosmetic dermatologist in Newport Beach, California. And today I'm going to be discussing a video talking about how to budget for cosmetic treatments over a year. And this was a question and a request that many of you guys asked me for my last video, my most recent video that I posted where I talk about treatments that I do, my diet, my exercise regimen, which you guys also asked me to post. I posted that one, and then a lot of you guys were asking, well, what treatments do you do, or what should we be doing, or how should we save or budget for treatments that will have the most efficacious impact on our skin long term, and how to invest in that, and how to save for that, and what to spend money on and what not to spend money on. And it's a really highly complex topic because given your age, your skin type, your pace that you're aging, are you accelerated aging? Are you aging, very slowly because you're blessed with good genetics, depending on your skin type, different exposures. I mean, there's so many different things that go into what treatments one should have over the course of a year, and how to budget for that. But so I can't really do a topic on that because it's multifactorial and it's highly independent on patient-to-patient basis. But what I can do is tell you treatments that I think over long term are worth it, treatments that are not worth it. And when you're spending money on these cosmetic procedures in your dermatologist's office, your plastic surgeon's office, or a med spa, you want to know where to save your money, because there's a big difference between spending a lot of money and not getting the results, or even worse, having complications or looking even worse, than even spending a small amount of money but having it be a really impactful treatment or a really impactful, efficacious investment of your hard-earned money on a treatment that's really going to take you far. So hopefully after watching this video, since I can't really customize a video to each individual person to saying, okay, you need to save up and do 4 Clear and Brilliance, 2 Fraxels a year, do under eye Fraxel 3 times a year, do 1 Thermage every 5 years. That's impossible because everyone's different, and even day to day in my office, in my clinic, seeing different patients of different, backgrounds, different skin thicknesses, different skin Fitzpatrick's types, different paces at the rate at somebody's aging. Some people age really fast. Some people age a lot slower because they're genetically blessed. It's hard to customize that. But what I can do is do a video on things that would be most impactful for you to invest your hard-earned money on and spend your time doing. Like, I'm not a big fan of at-home devices. I think they're highly expensive. They take up a lot of your time and they don't really do much. Like, you'd be better off saving that money and getting 1 laser treatment a year, and you'd get a lot more out of that than spending a lot of money on some at-home device or treatment that's not really going to do much, take up a lot of your time, and in the long run probably be more expensive because you're not even getting anything out of your investment of whatever home device you're using. Now, I'm not saying that about all home devices, but a lot of them out there. And also, most importantly, it's important to not spend your money on treatments that aren't going to work. So sometimes when you're actually trying to save money, you're actually wasting money, and it would be more efficient to save your money for a high-end treatment, high-end meaning high caliber, high quality, high technology, with a highly trained provider, and pay a little bit extra more to get the best device by the best provider and have that last, as opposed to cutting corners and having, a cheap laser done by an extender who really doesn't have the training to, or is equipped to perform these procedures, and then having a less than desirable outcome, or going to get, God forbid, Groupon Botox, where the reason why it's only $10 a unit is because the product is so watered down that it's basically like injecting water into your face, and that's why it's so cheap, and that's why your results don't last, and that's why your lids drop, because it's migrating, because it's watered down too much. Or getting, a treatment in a med spa with an extender that really hasn't had the training and really doesn't have anything to lose if he or she has a complication, because it's not like their medical license is going to get taken away. It's not like they're going to have any form of reprimanding because they didn't really put in the time or the work or the education or training to have any certification or board certification or credentialing or licensing taken away. So I think hopefully after watching this video, that's kind of the take-home message. You get what you pay for, and if you're going to spend your hard-earned money on treatments, what treatments are best and what treatments would be more effective over time. So all in all, I think one of the biggest investments that somebody can make in their skin long-term are lasers. Now, you're not going to find lasers as available as other treatments like microneedling or IPL or BBL broadband light. It stands for, BBL is broadband light, IPL is intense pulse light. Those two aren't lasers. Those are just broadband lights that you put a filter on and it tries to mimic a laser, but it's a cheap alternative to a laser. And oftentimes, you know, especially with IPL for melasma treatment example, it can make things worse. You temporarily look okay, but then you can get darker. And it just doesn't have the elegance or the technology that a laser does. But you're going to find a BBL or IPL or microneedling on more readily available in more offices or medi spas because it doesn't take a high level of skill or training to operate these devices. Now, if you have like a Pico laser or a Fraxel Restore or another laser that requires to understand, you know, laser physics and understand the settings, the spot size, the fluence, the pulse width, these are things that you usually will find in a dermatology practice or performed by dermatologists, or not even plastic surgeons really get this education and training in their residency because they spend, you know, their 7 years of their residency in the OR. They're not really doing skin treatments and, you know, and performing lasers. But when you have a highly trained laser provider and you have a high functioning laser, there's nothing like it. And I feel that it's the best investment of your time and money. And it may be a little bit more expensive than going to a medi spa and getting an IPL, but there's a reason why those treatments are less expensive. You know, you get what you pay for. So I feel like if anybody's going to save their money and invest in anything, it should be a laser at least once a year. Now, I recommend a Fraxel once a year for anybody over the age of 35. But that, again, can be highly dependent on the individual skin type and amount of sun damage and photo aging that has transpired. I mean, I'll have 25-year-olds that have more photo damage than, you know, my 35-year-olds. And so the 25-year-olds are actually having to have a Fraxel once a year, and the 35-year-old can push it until he or she's 40. So it just really depends. But I feel like whether it is a fully ablative, fractionally ablative, or non-ablative laser, it just depends on your skin quality, tone, and the results that you're looking for. So, but I do feel like there's no such thing as a wasted laser treatment, and whether you're getting a V-beam once a year or a Fraxel or even just a Clear and Brilliant, over time, that's going to give you healthy skin and longevity over time. And I can say this by the different patients that I see in my office. I see about, it depends on the day, which can vary, but I see about 25, patients or so a day. And they're of all age ranges, from their 20s, 30s, 40s, 50s, 60s, 70s. I even have 80-year-olds and patients in their 8th decade of life. And sometimes, I have to ask the patients who are older than me, who, are in their 50s and 60s, like, what were you doing to have skin this beautiful? Because back in the 90s, they didn't have Clear and Brilliant, and they didn't have the skincare actives that we have available to us now. And it's always, I've done lasers. I did lasers I did CO2, I did Fraxel in the 90s, early 2000s. And I know by following these beauties in my office, that really can have an impact on your skin long term. And lasers help stimulate your skin cells to act and behave younger, because cells become senescent as we get older. And what that means is they stop producing collagen, they stop producing elastin, they stop replicating themselves and replenishing themselves. Your skin gets dull, it gets hyperpigmented, it's spotty hyperpigmentation and uneven texture and uneven tone. That's because your skin cells start to fall asleep and get lazy. When you do lasers, you stimulate them to act and behave younger. You increase cellular renewal. They replenish their cell cycles. They rejuvenate themselves. They out with the old, in with the new. Your new basal layer stem cell, baby keratinocytes, the cells that replicate themselves bump off the mature ones, and your skin desquamates, meaning that top stratum corneum layer of the skin sheds off, and you have this bright, healthy, youthful looking skin. And lasers stimulate your skin cells to act and behave younger. So over time, it really makes a difference. I don't care if you're with a cane and you're gray haired and you have volume loss. If you have baby skin, it will carry you so much further with respect to looking refreshed and rejuvenated than if you just don't do anything except for a bunch of filler or injectables. Now, don't get me wrong, I do injectables on my patients all day long too, but they have their place. But nothing is important, in my opinion, as a laser. So investing in a laser, I think, is the most important long term. And for all you guys, in the last video, I talked about body procedures that I do on myself, but a lot of you were asking, okay, what facial procedures? And that's a whole other video, because this video would be like 5 hours long if I talked about it. But I've always invested in lasers and tightening devices. You know, I'm 45 now. I've done Thermage 3 times. I've been Fraxeling under my eyes since I was 22 years old. I do a Fraxel at least once, sometimes twice a year. I do a Clear and Brilliant every couple months, especially when, you know, we have like an event to go to or we're going on vacation. I'll do a little Clear and Brilliant to rejuvenate my skin. But I feel like long term, you know, people who are my same age who haven't done these treatments and procedures preventatively, you know, you can tell a difference. And it's not so much what I've done this past year, but it's what I've been doing since I was in my early 20s. Now, granted, yes, I had access to a lot of lasers, and half the time when we were in residency and training, we're practicing on each other on how to do, like, how to do treatments with these lasers. And I remember I was giving myself and my co-residents like Fraxel treatments when we were like 27. Did I need it then? Probably not, but I was inadvertently and unintentionally giving myself, you know, preventative laser treatments that would benefit me longer, you know, later in life. But we were just kind of messing with these lasers and using each other as guinea pigs, which was actually really fun. But I remember hearing the lecture where, you know, we learned in our dermatology lectures in medical school that the secret to longevity and stimulating collagen and having youthful skin is lasers. And I remember I took the key to the Brenner Research Lab, and I went into the laser lab at the Beckman Laser Institute at UCI, and I was lasering underneath my eyes, and I was doing all these things. So I've always kind of been fascinated and interested in lasers before it was cool to do, and I think it has paid off long term. So what type of laser do I recommend for my patients? I feel if you're 35 and older, a Fraxel once a year is the biggest bang for your buck. If you're under 35, I think just doing like a Clear and Brilliant is definitely worth it just once a year. Once a year is better than not doing anything at all, or wasting your money on 3 IPLs that are really not going to have any like long-term benefits, or wasting your time doing treatments in office that are not going to be as effective or efficacious because either they're watered down, they're not being administered appropriately because they're at such a discounted cost, and that's why they're discounted. So I think that that's one of the main things that you could do. Also, investing in a good sunscreen, being really diligent about your sunscreen use, and it doesn't have to be a fancy or expensive sunscreen. I mean, I have my favorites. I love Color Science. There's several sunscreens that I really feel are best, but honestly, just getting a mineral-based sunscreen that's, you know, that's a higher percentage of zinc or titanium dioxide, and one that has iron oxides in it, because remember, iron oxides also protect our skin from environmental pollutants and blue light and HEV light that's emitted from our devices. So it's not just about the ultraviolet radiation that we get from the sun, but it's also, you know, the things that our skin encounters on a daily basis, toxins, pollutants that can increase matrix metalloproteinases and break down our collagen, causing fine lines, wrinkles, enlarged pores, textural irregularities. So you want to make sure that you have a good mineral-based sunscreen with iron oxides in them as well. I think chemical sunscreens are okay. They're not my preference, but I know a lot of you use chemical sunscreens, so they always say the best sunscreen is the one that you use. I don't care which one you use, but you have to make sure that you use it and that you reapply it and you're diligent with it. So in saving for an annual budget for treatments and procedures and products that are going to give you long-time skin rejuvenation and optimal skin health, I think sunscreen is right up there. Investing in a good sunscreen and investing time to reapply and to photoprotect accordingly. Doing one type of laser a year, whether it's Fraxel, Clear and Brilliant, even if it's like a V-beam. So V-beam, V just stands for vascular, and a V-beam laser is usually known for its ability to reverse rosacea, to decrease redness, to decrease facial telangiectasias and broken capillaries. But honestly, doing a V-beam over the entire face has potent rejuvenating effects as well. I just recertified my dermatology boards, and I don't know if you guys know this, but after achieving board certification in your specialty, which of course mine is dermatology, you have to recertify and read up on all the literature and new advances in technologies and answer questions on, you know, these new, treatments and discoveries in dermatology every like 3 to 4 months. And V-beam was actually one of the lasers that they were listing all of these amazing effects from V-beam, like increased collagen synthesis, improvement in texture, and not just relieving redness and erasing redness and redness and rosacea, but also just rejuvenating effects of a V-beam, which I've kind of already known because I remember back when I was a fellow, I remember treating all my rosacea patients, and I'd see them a couple years later, and I'm like, wow, not only, your redness is gone and your rosacea is gone, but you look amazing. Your fine lines and wrinkles in your skin quality and texture just look better. So I've always kind of known that, and I do think that V-Beam is one of those lasers that a full face treatment will benefit you long term. So if you want to include that as one of your lasers once a year, I think that's your best bet. Now, laser pricing can depend on the type of laser and the skill of your provider who's performing these treatments. Usually when you're talking about a laser, like a true laser, not like a pretend fake laser, like some that you'll see out there that are some out-home device or an IPL or a BBL, it usually comes at a little higher price tag. It can start at anywhere from $600 or so to maybe $3,000. But over the course of a year, saving up to do that, you're spending your money on one treatment that will make a more impactful, significant effect on your skin than spending $300 on an at-home device, $200 at a med spa with doing some microneedling, something that's not really going to work. So it all just depends. You want to put your money in the most effective, efficacious treatment plan possible. And sometimes you have to be aware of the saying that you get what you pay for, because you really do. And I see it every day in my office. I see my patients, my clinic is 100% cosmetic. All we do is aesthetics and cosmetic dermatology and lasers, and many times I'll have patients that have had treatments done on the outside, and they spend hundreds and sometimes even thousands of dollars on treatments that either made them worse or they went to the wrong person, and it's kind of hard to know where to go and who to trust. So I always say, look at people's before and afters. A provider doesn't have to be, a board certified dermatologist who's fellowship trained. If you really want the creme de la creme, you'd get an ACGME fellowship trained laser specialist, but there's very few of us out there. But just going to someone who you trust, and maybe word of mouth, you've had a friend that had a treatment done by this provider and you've seen for yourself the real before and afters, or ask in the clinic to say, hey, can I see your before and afters? Now, if they're showing you before and afters of a procedure that they provide, but it's not their before and afters, like, oh, this is another doctor's before and after of a V-beam, that's not going to cut it. You want to ask your provider, how many of these have you done? What is your experience with this device? How long have you been using? Where did you get your training? Let me see your personal before and afters. If they show you the before and after, say, are these yours or are these somebody else's? So don't be afraid to ask these questions, because I want to empower you guys with the knowledge to protect yourselves from less than desirable outcomes or complications from happening, or wasting your money on things that aren't going to have an impactful, significant outcome on your skin. So the next treatment that I think you can save up for over the course of a year is Botox. Now, Botox is highly controversial, and I know there's going to be some people out there saying, I don't want to put toxins in my body, or it's botulinum toxin. You have to remember that Botox is one of the best things that you can do for your skin long term with respect to anti-aging effects. And it's the most highly studied and regulated pharmaceutical on the market. So I've been told. There's been more research and development in Botox, not only for cosmetic uses, but also for medicinal purposes and other specialties. Neurologists use it for migraines and cluster headaches. Urologists use it for urology patients and stenosis, and pediatric uses of it include cervical dystonia, muscular dystrophies. So Botox is used in the medical space for non-cosmetic uses. So it's been highly researched and highly studied, and I've been told it was the most researched and studied pharmaceutical on the market today in the US. So if Botox isn't for you, just keep fast forwarding through this part of the video. If it is for you and you're open to it, just understand it's a safe and effective treatment, and long term has one of the most potent benefits over a lifetime for rejuvenation and anti-aging. Now, how much should you expect to spend on Botox in a year? That just depends on the number of areas treated and where you go to get your Botox. But just be mindful of, cheaper is not better. You would rather not spend $200 on or $100 on watered down Botox that's not going to do anything, versus going and spending $500 to $600 on Botox that's concentrated and efficacious and reconstituted the right way, injected precisely to give you the most longevity out of that treatment. Now, some of my patients come back every 3 months for Botox. I have some patients who come to see me every 6 months, and I actually have patients who come in once a year. Sometimes people fly in from different parts of the country and they come in to see me once a year and they get their Botox. So it all just depends on each individual, how long the Botox lasts, but keep in mind that you do get what you pay for, and if it's watered down, it's not going to last as long, and it may not give you the outcomes that you're looking for. But overall, you can think to spend anywhere from $500 to maybe $2,000 on Botox, depending on how often you're doing it, to kind of budget in a year-long kind of snapshot in time when you're thinking about cosmetic treatments and how to save up for them. And last but not least, the third component to investing in things that actually are the most meaningful long-term for your skin. We've talked about lasers, we've talked about sunscreen, we've talked about Botox, but that is skincare. So I always say going to the gym is like going in the office to have a procedure done, whether it's a laser, a peel, injectables, and going home and eating clean is equivalent to your skincare actives. So think of lasers, going to the gym, using good skincare products at home is eating clean and drinking your protein, things like that. So investing in skincare products that are highly efficacious and have high technology, you don't have to have a lot. And actually, you only need one good skincare active. If you're on a budget and you want to go more drugstore for the majority of your products, but invest in that one that works really well, I think that's really important. I have my own skincare line, MDR, which is just a personal chemist and me, and I take data and scientific research straight from the medical community and I put it right into the products. It's high end, it's high technology, it's innovative vehicle delivery systems, and it's skincare actives that are high quality. So of course the price point is going to be higher than something you're going to find in a drugstore, but also using the products within 2 days, you're going to see a dramatic improvement in your skin. Anybody will. Your friends will notice, you'll notice. That's the difference. When you're using drugstore or other products that maybe aren't higher grade, like MDR or Zeo Skin Health or Skin Better Science or Elastin or SkinCeuticals or Skin Medica, there's a ton of them out there, but you notice a difference. But that's not to say you have to have every single skincare product from that line, even mine. So if somebody wanted to save money, I would say invest in a good sunscreen, just like we talked about earlier, and maybe get like a moisturizer or a hydrator from a drugstore that, just does the job, has some ceramides in it. It's going to re-strengthen the barrier, minimize transepidermal water loss, do all the things, but you don't have to have like high quality peptides that were engineered and, are a little bit higher quality and a higher price point. You just pick for you, I feel like, one good skincare product that you can invest in, and that's the best investment that you can make. And then you can kind of mix and pepper it in with other drugstore and products that may be less expensive. Also, using a prescription strength tretinoin is also useful, but sometimes even though those are prescription strength and insurance doesn't always cover it, that could be expensive too. So some skincare products are going to be expensive, but you always have to see which ones are worth it, which ones are not. And I think like just trying it, and if you see changes in your skin within days of use, then you'll know that product's worth it and it's worth a higher price point. And they don't all have to be medical grade or higher price point, but just having at least one. So I think investing in good skincare products long term is super important. And like I said, I see patients of all ages in my office, and the ones that have been using high quality medical grade skincare products over a lifetime always have the most beautiful, healthy baby skin. I can even tell when I run a laser over somebody's skin how healthy it is. I can tell how strong the barrier is, how hydrated it is, how tolerant it is, or how weak and defective the skin proteins are, because the endpoints are different. So I think that, investing in good skincare products, and at least one good skincare product while you're using, your whole regimen, the rest could be drugstore if you want. It would be better to have all high quality medical grade, but I know that that's not feasible for everyone. But at the same time, it's hard for me to recommend, Neutrogena Hydro Boost over, my vitamin CFK, because there's just no comparison. It's like saying you want to get from point A to point B faster. You can either take a jet or you could take a car. Like the jet's always going to be faster. It's going to be more expensive, but pound for pound, I can't recommend the car when I've been flying in a jet this whole time. So it's hard. But I do think it's important to just keep in mind you don't have to spend all your money on high quality medical grade, science-based and backed dermatologist formulated skincare. But I do think that investing at least one over time will really be beneficial. And then you can get things from the drugstore like adapalene or Differin or retinol from a drugstore. Now it may not be microencapsulated and it may not have the elegance of a medical grade retinol, but at least you're getting that. And I think that that's most important. And when you're trying to cut corners, make sure you don't skip on your actives. A vitamin C, a retinol is always the most important, and a sunscreen. And then throwing in some Botox and a laser once a year I think is really important too. So things not to waste your money on and what not to budget for. I have never been a big fan of microneedling. I've seen countless and countless patients come in saying, I've spent so much money and didn't see any results, or I saw maybe a little bit of results, or things got worse. I got hyperpigmented, scarring, infection, things like that from microneedling. And so anytime an office makes you buy a package, with the exception for Emsculpt, because Emsculpt you really do need 4 treatments, in 2 weeks to get the results, but that's different. When I'm talking about facial aesthetics and like lasers and procedures, whenever there's a membership or a package deal, I always say run out the door. There's a reason why. You want to be able to have a procedure and love the results and come back because of that. You don't want to come back because you're roped in, okay, I have to go back for 2 more. I hear my patients say that all the time. They're like, well, I want to do a laser with you, but I have to do these 2 more treatments, of microneedling at this office. I'll say, well, did you get a result with the first one? And they're like, no, but I've already paid for it, so I have to go back. And it's just like, there's a reason why offices do that sometimes. I don't do that in my office because I want patients to really love their treatments and come back for more and then switch it up if we need to. And so I feel like not wasting your money on things like microneedling, treatments that are less than optimal, and having treatments performed by somebody who is not highly trained is something that you don't want to do. Now, other treatments that are fun and can be advantageous, but maybe that aren't like 100%, slam dunk, you need to do this. I don't think peels are awesome. I think peels are actually making a comeback, especially the phenol peels, but I don't think it's one of those ones that it's like a must have, you have to do this. Peels are nice. Facials, I think, by estheticians will help keep the skin rejuvenated, but I have some patients who come and get a Clear and Brilliant once a month. They don't have to do a facial once a month. You just pick and choose things that you want to do, but I do think facials are important, and it's something that it's important to kind of budget your your finances for if you want to invest in cosmetic treatments, like kind of looking at snapshots year to year. And what else? I think things like, Thermage is good every 5 years, or some type of tightening device. I'm not a big fan of Ultherapy. Now we have Elicor, that's a whole different video, but some type of tightening device, if you're over the age of 50, I think would be important. And it depends on if you're a really proactive, motivated 30-year-old like I was. I did Thermage when I was 30, 35, 40, and 45. So, I feel like it saved me. I've done lower face Thermage. That's something, though, that you'd want to budget for every 5 to 10 years. So I hope after watching this video, it kind of makes sense. And in summary, I would do a Fraxel or some type of resurfacing once a year. I would do under eye Fraxel. That's something I forgot to talk about. Maybe twice a year, depending on your age, to keep the under eye area nice and smooth and tight. I would invest in Botox every 3 to 6 or 12 months, depending on how animated you are, how strong your muscles are, investing in a good sunscreen, and investing in skincare actives. But all in all, it's the skincare and the lasers that will give you the healthiest skin long term, and those are the things I feel that it's the wisest to invest in. And as far as treatments that I've done, that'll be a whole nother video. And if you guys want to hear about that, I'll tell you about it too. But keep in mind, it's not so much as important what I've done this last year. I actually haven't done that much this last year. Of course, I keep up on my Botox. I'm not as big into fillers now that I'm older. When I was 27, it was fun to do my lips and my cheekbones. But now that I'm older, I am more into lasers and tightening devices and resurfacing my skin, not just doing a bunch of fillers. I have probably less filler on my face than I do now than I did when I was, in my 20s and 30s. But I'll go over all this in another video. But for me, I feel like, lasers, tightening devices, skincare actives, and sunscreen has saved me, and the biggest procedures that I've done on myself that have been the most impactful over time. So to answer the people's questions who ask me, how much do you need to save for a year or spend on cosmetic procedures? I mean, that can range anywhere from $1,000 to, $5,000 or even more. But it just depends on what treatments you decide to do and where to put your money. So, it all depends, but lasers and skincare actives and photo protection, I feel, are everything and the most beneficial for your skin long term.